For wounds on the lip, it is not always possible to achieve an aesthetically perfect result with conventional methods. After the lip of a 4-year-old child had stopped bleeding, the edges of the wound were adapted by stretching and sealed with 1 drop of the tissue adhesive. The wound was then covered completely with Epiglu. After 11 days, the healing process was completed to such an extent that the wound was hardly visible. We recommend in such cases that on the following 1 or 2 days, the patient should return to the practice. If the adhesive does not adhere firmly to the surrounding healthy skin due to movement of the lips, the adhesive can be reapplied. The remaining adhesive should not be removed. The patient had tripped over and suffered a laceration on the back of the head. The hair around the wound was removed with scissors and Epiglu applied. No further treatment was necessary, so the patient did not return to the practice. After a few weeks, a further photograph was to be taken, but the wound could not be found. This patient had navy removed from both the left and right-hand side of the nostrils. On the right-hand side, it was removed with a scalpel and treated with stitches. On the left-hand side, it was removed with the radiosurgery device RadioSurge and treated with Epiglu. 2 weeks after the operation, the different healing processes are clear to see. The plantar warts were removed using the radiosurgery device RadioSurge and a small ball electrode with coagulation wave. The wound was treated solely with Epiglu. The picture on the left shows the wound 1 day after the operation. The picture on the right, 3 weeks post-operative. From the outset, the patient was largely pain-free and could walk and drive. There was no recurrence. A sculptor injured himself with a modelling tool on the palm of his hand. The wound, which had stopped bleeding, was treated solely with Epiglu. After treatment, the patient was pain-free and could shake hands so firmly with a visitor that part of the Epiglu came off. The remaining Epiglu was not removed, but covered with a further layer of Epiglu, as can be seen on the 3rd picture. A small dressing was used as protection. A German doctor who works as a volunteer in Belize, one of the smallest and poorest countries in Middle America, sent us this picture. As we support the hospital in which she works by donating Epiglu, she was able to treat the deep wounds of a woodcutter quickly with Epiglu. The patient could immediately leave the hospital and was happy that he did not have to travel the long distance again to have stitches removed.